You ready to start?
Yeah.
So, the topic is CTSD symptoms and effects. PTSD is a mental health condition which is triggered by terrible events, whether witnessed or experienced. Symptoms include flashbacks, nightmares, severe anxiety, uncontrollable and intrusive thoughts about the traumas or events. And I'll stop for um, Stacy and Diana. You were the ones that missed it to respond. Do you want to?
So what am I supposed to respond to? What my symptoms are, or?
Correct. For the ones that I listed, I'll say them again.
Okay.
Which ones do you think? I'll stop at the first one and I'll say that. And which one of those do you experience, and how does it affect your life? So flashbacks, nightmares, severe anxiety, uncontrollable and intrusive thoughts about the traumas or events.
Okay. I have ADD, so if I miss one,
Apologize.
so I have my symptoms are, I guess it would be anxiety, but it's more hypervigilance, and which is close to anxiety, but like on a whole different level. And that has debilitated my life for about 5-6 months. I mean, I wasn't getting out of bed. I wouldn't eat. I couldn't sleep because then the anxiety or hypervigilance was so high. I would have insomnia, which made it difficult for your daily self-care, coping skills, all that. Was other ones. Oh, flashbacks. I'm having major flashbacks now, but I haven't always had them. And it took me about, I just got diagnosed with CPTSD, like for real, this past June. And I have just realized what my flashbacks are now, like within the past month and a half. So I'm working on those. Boundaries are huge because of the shame and the guilt that I get from the PTSD. That goes away, or for me, it went away slowly. It's still there a little bit, but with therapy, it helped me. Nightmares I have every night. And I don't know what you mean by intrusive thoughts about the trauma, like just thinking about it.
So that can include thoughts that just come into your head when you don't really want them there, or it could be as extensive as suicidal thoughts.
Right now, at the beginning, I was having very intrusive thoughts, very suicidal thoughts. I self-harmed, but right now it's gotten better with a trauma therapist. So right now, I feel like my intrusive thoughts have gone away. The depression has gone away. The depression was bad at the beginning. But it does get easier. I don't know. Did I miss any of the other ones?
No. So are you on an antidepressant for your depression?
Yes. For my depression, I am on antidepressants. Do you want to know what it is?
Sure,
I don't care. I don't care. It's Zoloft. And for me, it saved my life. It's the only thing that got rid of the intrusive thoughts and the suicidal thoughts and the self-harm, and the depression overall is helped from my Zoloft. Everyone's different, but that's what worked for me. And as for my hypervigilance or hyperadrenaline or extreme anxiety, I have anxiety meds to take at the moment I need them, which has decreased over time. Struggled very hard with the anxiety and the hypervigilance. Um, and then for my ADHD, I'm on medication for my ADHD. I'm on Vyvanse. And then also,
do you believe that you need the ADHD medicine? Like, do you know that there's a lot of people that don't take it?
yeah, I mean, I have gone years without taking it, on and off. And I mean, eventually I would rather to be not on any medication at all, eventually.
Cool.
Like I said, I'm still fairly new, and it could take up to 9 months, 2 years to, whatever. So I am slowly like lowering all my medication, but my ADHD medicine,
Saved your life.
it saved my life. You have no idea. Like, I remember to do things. My kids will ask me something, and I finally will remember and not feel guilty that I couldn't get out of bed, or like I couldn't remember the things that they were telling me.
Right.
I think that helped me the most.
Focus.
What?
It helps you be able to focus.
Yeah, and just remember things. Yeah, finishing tasks, and it even slows down my anxiety. Like, my mind is not wandering like a ping pong ball. Like, when I take it at ease.
Do you ever get hyper focused on top of anxiety?
Yeah, does that mean like nonstop? Nonstop.
Like, what do you usually hyper?
You need an answer.
On?
Yeah, you're too into something. Is that what it is?
Well, it can be a good thing. Like, if hyper focuses on drawing, because he has ADHD as well, or playing with his wrestling figures, or watching TV in the tablet at the same time, which I want to kick his ass for. Like, you can't watch both at the same time. He's always, whatever, like, it's something that interests you usually is why you can hyper focus. If you don't have an interest in it, then you're not going to really care.
Right. It's like an all or nothing kind of thing. It's like, if I have no interest, it's not happening. But if I have an interest, I don't stop. Like,
You feel like you have a particular interest that you really hyper focus on, or is it different at different times?
It's basically been the same. I mean, it's always been like arts and crafts, like painting and stuff. That was hard for a while. I just got back into it. But the whole time, I've never lost especially on the medicine, I hyper focus. Like, I want to research about what our mental health, all the different mental health outlets and the resources and conditions.
I was just gonna say, I don't have ADHD, but I get wrapped up in something, and when I do, it all has to do with the group stuff.
Me too. I have a whole folder, and I have
So I was just gonna say, Stacy, that I meant to read. I wrote down hypervigilance and also disassociation. So I'll just.
Oh yeah, I forgot about that. That's like my number one thing is dissociation.
Yeah. So these are the actual definitions. So hypervigilance is extreme or excessive vigilance, being highly or abnormally alert to any potential dangers or threats, possible disturbances in sleep, irritability, heightened startled responses, and flashbacks of the original traumatic event or events.
Is this hypervigilance that you just read, or dissociation?
Hypervigilance.
Okay, that's right there. Okay.
So that's what that means. And then disassociation, which I think every single one of us who has PTSD or mental health has gone through this, but the actual definition is the disconnecting or separation of something from something else, or because of someone else, often associated with traumatic event or events. So I think both of those are true.
Yeah, for real.
Would I'm gonna mute. Would anybody else like to respond to that?
Oh yeah, I've been through both of those. I mean, I've been through them all in between 13 and almost 53. So I've got 40 years and I've gone through every one of them and through them sometimes twice. I still have PTSD. Vocational PTSD is the worst because I
But
have the startle response.
does any of it get easier?
Not for me. It's gotten worse for me over age. I mean, some things have gotten easier, but others no.
Oh yeah, that's what I just always, I always hope for. I don't know. I hope it doesn't last forever.
Yeah, I don't know. I guess I'm just the unfortunate one, the mind over matter. As people used to say, oh, you don't need the meds. I was like,
I hate that saying, the mind over matter. It drives me.
I used to look at them and say, yeah, but my mind would say it doesn't matter.
Yeah. I try, but.
If I didn't take meds, my mind would say it doesn't matter. So.
If I didn't take meds, I would be my personality would be all different. I'd be erratic and emotion, like crying, or I don't know, like emotions off,
Oh, mine is so bad right now, but it's just because I need to get back in touch with my psychiatrist because they took me off of one med that was controlling both my bipolar and my pain. So it leaves me only with Depakote and Ambien.
Oh, Ambien never did anything to me, ever.
No.
Dinah, have you got fibromyalgia as well, yeah?
No, I have neuropathy, tendinitis, osteoarthritis, L5 damage, arthritis.
You name it.
Yeah. I have the fibromyalgia, Brett. Me and you do.
Yeah.
But that's from trauma and all that.
Yeah.
Right.
Not always, but sometimes.
And then on top of it, I have stage 3 kidney disease, so I'm limited on what medications I can take.
Oh man,
because they're trying to keep my kidneys from failing.
Oh, I'm sorry.
Oh.
So what about what we were talking about earlier? Do you get Diana? Do you get like intrusive thoughts of nightmares and stuff like that, or severe anxiety? Yeah.
I have PTSD. I have general anxiety. I have what they call low mood depression, bipolar 2. I'm trying to think what else. Bunch more.
Yeah, loads of fun. Hang on a second.
Regular anxiety.
Right, the list goes on.
Yeah.
Hi, hope you're enjoying our content. We have quite regular conversations on the CPTSD groups, talking about all kind of mental health issues. We're just ordinary people having conversations, sometimes reading information, reading stuff from books, and then discussing it, and also sharing our own personal experiences. So if you're enjoying our content, please like and subscribe and help us to end the stigma.